Ladies and gentlemen, good morning. Welcome to the third Avatar Medicine Forum. I'm your host for today, and I'm delighted to have this opportunity to meet with our audience once again this year. This year marks as the third year of our Avatar Medicine Forum, and our goal, as always, is to deepen everyone's understanding of the new concept in Avatar medicine for patient treatments. In 2023, it has been a remarkable year for AI technology, significantly transforming various industries and taking Avatar medicine to a new height, seamlessly integrating into various aspects of human life. Our third speaker has a unique era of expertise. Please welcome Mr. Tony Chung, the CEO of Instant NanoBiosensors, who has a dedicated year in the field of animal science, biotechnology, and biomedical instruments. Today, he will introduce to us the next generation gene sequencing. Let's look forward to his presentation.
Hello everyone, this is Tony from CEO of Instant NanoBiosensors. It's an honor to have this opportunity to presenting our solution of the precision medicine. Let's first to understand the word of the precision medicine. Precision medicine is a medical model that proposes the customization of the healthcare with a medical decision treatment or the product being tied to the individual patients. In this model, diagnostic test is often employed for the selection or property of the optimized therapy based on the context of a patient genetic and all the molecular or cellular analysis. And how is the difference between the traditional medicine and the precision medicine? Let's look into the slide and mention about the difference between those of the two. First, to look at the traditional medicine, it is what we are familiar with. The treatment accumulated over many years through the clinical experience. For example, like a radiation therapy, use a high-energy patient to damage or destroy the cancer cell. The other is a chemotherapy to attack the cancer cells through the chemicals. And the third is the surgery, operation or part of the body to diagnose or to treat the cancer. However, with the advance of technology and the researchers, we have gradually entered a new medical realm, which is called the precision medicine. So what it is, precision medicine? The precision medicine is an advanced personalized treatment. The treatment is no longer just for the majority, but also the tightest according to each of individual gene, environment, and the lifestyle. And the other thing is the genetics. A gene sequence help us to pinpoint a gene because those of cancers. And the other the third part of the precision medicine is the immunotherapy. Search for ways to customize the treatment, to activate the most of the immune system to find the cancer directly. Personalize the treatment with some immune activation drugs. And about the target therapy, these drugs can be turn specific gene or turn it on or turn it off. And they can be combined with a traditional treatment to achieve the better result. So when we mention about traditional medicine and precision medicine, we actually discuss the two ways to distinguish the treatment methodology. The traditional medicine starts from the holistic point of the view, which is a precision medicine start from the uniqueness of each individuals. However, they are not for the like a treatment is not only like a traditional medicine or precision medicine. Actually, we need to combine both of them for more comprehensive and efficiency the treatment. I hope this can be lend us to understand what is a bit different between these two. And to go further to understand the precision medicine, first, the early of the on-size fit-all treatment approach. The core concept of these methods is that most of the patients can receive the same treatment. The advantage of this method is that when they find a treatment effectively for the majority of the patient, we can provide it quickly and just large quantities. However, the limitation lies in the fact that each of the patients have a very unique part, and also the gene difference and the lifestyle are unique. And the pregnancy approaches cannot meet the needs of all patients. To move the second phase is stratified medicine. Here is the begin to understand the difference between the patient most deeply. So the patients are no longer just subjects in need of the treatment, but also to be characterizations based on the disease subtype. So the demographic of the categorization and also the clinical feature and biomarker. This means the patient with the same disease might receive the different treatment plan. And then when we receive a modern precision medicine, this is actually we talk about a truly personalized treatment approach. The precision medicine takes into account a patient personalization preference, past medication history, environment factor, and even for the behavior and also the habits. Additional biomarkers are used to determine the best treatment strategy. And to sum up, from the on-site fit for all medicine and for the stratified medicine and for the precision medicine, it is continued to help us to more efficiency and more personalized treatment in this stage. This is not only presenting the advance of the medicine or medical technology, but also to symbolize our care and respect for the patients. Hope these will to provide with a treatment suitable for personalized. And to go further to understand, in the traditional medicine, we often categorize and treat patients based on the symptoms. However, the modern precision medicine has advanced further understanding patients through the molecular level data, providing more specialized and accurate treatment. How is the achieved? The answer lies in the data we process first. So, for example, like the episode, which represent all the environment factor in a patient encounters through their life, from the food, air, daily habits, and so all the factors that influence the life of the patients. Next is a genome. Our genetic information determines the biological trial. As a research progresses, we've also discovered the metabolism, epigenomics, and the transcriptomes. They revive all the body's metabolism process and gene regulation and the gene expression. Furthermore, our body hosts a vast through the microbiota ecosystem, comparison those bacteria, virus, or micro environments. All of these which play for a very critical role in our health. Of course, we also need to consider the clinical information and those of the data for each of the patient. These provide a border of the background on the patients, help to understand more related risk factor and impact. Okay, so when we combine all the information, we can set up a precision medicine sharing platform. These precision medicine platform not only use a comprehensive understanding of each of the patients, but also allow us to clarify the patients based on their molecular data. Okay, so now we have a more opportunity to have a more deep and customized patient classifications. This is not just a new technology or strategy. It is a medical revolution to understand and treatment each patient for more accurately. So how is the difference between with precision and without precision medicines? As we just mentioned, we adopt a one size fit for all approach, which each patient will given the same treatment, while the methodologies with the carefulization, its efficiency is often rely on the luck. So which means how lucky you are, right? So the patient benefit from the general treatment, but many did not. Yeah. So since we essentially treatment everyone in the same way, without consider these very unique genetic makeup and physiological structures, the outcomes were unpredictable. Okay, further and of the today, precision medicine stands for the front four of the medical advance. Before the determining of the treatment strategy, we first conduct a DNA test. This test offers a unique genetic blueprint of the patients to understand and the potential treatment response. And to arm with this knowledge, we no longer provide only genetic treatment. To instance, we always titers the therapy. Each of the patient is custom-made, optimized, and designed for the individuals. And the result, almost every patient benefits since the treatment is specialized, designed for their unique needs and genetic composition. So that's the sum up of the disadvantage and also the advantage of the precision medicine. The advantage we just mentioned to sum up is the efficiency of the care. By understanding the patient's genetic makeup, doctor can quickly determine the most effective treatment method, reduce the trial and error treatment, and save the time. And also the preventive care. With a precision medicine, we can predict the health risk a patient might face, thereby offer the preventive advance and treatment. And also to reduce the cost by minimize the unnecessary treatment and drug expense. Therefore, these potential and long-term care saving in the medical cost. And the last one of the advantages is the population health. The precision medicine always contribute improvement of public health, and it helps us to understand the distribution and cause the disease within a specific group of the people. And after we understand the advantage of the precision medicine, there's to talk about the disadvantage part. For the infrastructure of the requirement, so the implement precision medicine demand need a lot of data advanced technology. This means that the significant investment are required to establish the maintenance of these infrastructures. And the other things we need to think about is the legal things. The issue related both loss of the privacy of the genetic information and data storage can be lead to legal disruption and charges. And some of the relevance of the information, not all the genetic information are necessarily related to and direct to the patient health condition. And this will be interpretation. The data might request the doctors and specialists their knowledge. And the last one of the disadvantage is the health care cost. And while the loss of the precision medicine might save the cost in the long run, but in the initial investment and certain of the tasks can be quite expensive. So based on this, and we look into some of the tightest laboratory work, how these precision medicine be running after the patient they have a liquid biopsy, or they have a sample delivered to the hospital or the laboratory. So we always, for example, running through the morning to the noon to the evening. It took more than 24 hours and more. And so the how to speed up and how to from the manual to robust those of the to overcome those barriers. That's a very important thing. They were also to improve those of the clinical data outcome. Okay, so our solution is to provide the simplified and also the NGS population, and from the laboratory to the robust experiences. As you can see, all the idea and design actually is just on one compact machine, and also all the tightest work of those of the laboratory things, and also we mentioned about is need a technician. So in the normally, as you can see, those of the bench of the lab, you need a lot of the accessory or equipment. But use our NGS workstation, only need one machine can achieve and to overcome those of the tightest works. Just let me to show you some of the information about this. As you can see, the whole the pipe payment and whole the steps through robots. So not only use a robotic arm to handle those sample, and also to help us to overcome those of the laboratory operation, to narrow down those of the errors, and also to increase those of the batch performance. Yeah. So all these idea that is a robust and through the robotic arm. So you can, as you can see through this on that lots of the works that can run in smoothly. Yeah, we can take a while to look into those operation, and for you to see how the laboratory and all the robotic works well. So this step is the AT pipette into the deep well, and which means that those of the library preparation, once your DNA be extracted from the machine, that can be automatic handling through these library preparation. So we'll help you to do all of the things with the SOP, and also with the precisely protocols, without any like batch and batch, or like a human loss of the manual process errors. Yeah, we don't want to look all the video that we do have some more information, since I would like to highlight to you. Yeah. Okay. So these hold these library workstation with the NGS panel. There will be automatic running through the robotic and also the workstation. And after the running, we directly put it into the NGS. So for example, like Illumina NGS is very famous, the NGS sequencer. So after that, we will generate data, and through our platform that we can analyze this and have a report to show to the clinicians. And just give you one of the example that we run in the leukemia cancer panel, which is the blood tumor happen in the patients. So the manual process it has a very tight list of work from the DNA extraction, quality control, and library preparation, and those of the sequencing and data analysis, the steps. Although these are also shorten those steps, but through the robotic workstation that will speed up those procedure. Yeah, and then these kind of the leukemia cancer panel already get the CAP, which is the American Pathologist certification in the laboratory developed testing. And we do have the other multiplex NGS panel, which is cover the cancer and also provide the cell-free DNA NGS panel, and also the BRCA panel for the breast cancer, and also the lung cancer or colorectal cancer and pancreas cancer for the most of the cancer type. And if these doesn't show on our testing kit, that we can do the customized multiplex NGS panel, yeah, for project base. Yeah, so the whole of the kit that we manufacture in our ISO factory, as you can see, is the automatic dispense and pass ISO certified factory, these kind of the certification. So it's a great honor, and we have this opportunity to present our solution of the envision to achieve the goal to help the healthy care have a speed up and improvement. Thank you very much. This is Tony Zhong. Thank you for your time. Thank you.
Now we officially enter into the Chinese language presentation segment. Before introducing our next speaker, once again, thanks to Tony for providing us with a comprehensive understanding of knowledge related to genetics.